Hi, I'm Bob Schrupp, physical therapist, providing you with treatments that you can do within the confines of your own home. One of the things that when you are trying to treat things on your own, one of the big questions is, should I see the doctor, or when should I see the doctor? Now, with back pain, it's a lot of times there's a question mark and there's a lot of gray areas and there's a lot of what we call red flags where you might want to really think about seeing a doctor. But this is an occasion where you absolutely must go see the doctor as soon as possible. All right, usually the way this starts off is you're starting to have some back pain, and then at some point you start to be experiencing what we call saddle paresthesia. What does that mean? It's a fancy term which means if you were to sit on a saddle, all the areas that would hit the saddle are starting to feel numbness or tingling. So your inner thighs, your buttock, your sexual organs, your anus, all those areas are starting to feel numbness or tingling. In addition, some of the things that you might experience in addition to that, you might actually have some weakness in the hip muscles, or you might have some weakness in the muscle that pulls your foot towards you. So the one that actually pulls it toward you, that way. You may have trouble with your bowel or bladder. That's one of the questions that we always ask patients. You may either have trouble controlling it, or you may have trouble with constipation, either one. But if you have bowel and bladder problems, that may point to the fact that this particular emergency situation is going on. The other thing you might be having trouble with is your sexual organs, obviously, because this does affect that numbness, tingling, and unable to use it in a sexual fashion. So that, if you're having weakness like in the foot, I would probably go see the doctor anyway, but it's not an emergency. But if you're having back pain along with the saddle paresthesia, the sensations of numbness or tingling in the area where you sit on a saddle, that to me is an immediate emergency. And let me tell you why. Generally what is occurring, now a lot of things could cause this, but one of the most common reasons by far that causes this is what we call a herniated disc or a slip disc. The disc between one of your vertebrae is pushing on the cauda equina, which is the nerve roots coming off your back, and usually that means it's a huge herniation. And it's putting pressure on those nerves, and what it can do after a while is actually kill those nerves. And if they kill those nerves, just imagine what that means for you the rest of your life. It might mean you're going to be incontinent of bowel and bladder, which means that you won't be able to control when you go. You might lose all your sexual function. You might lose some strength in your legs. So these are dire circumstances in my estimation. So this is a time. If you're getting back pain, and along with it the saddle paresthesia, it is the time to go to the doctor or emergency room immediately, and they have to determine what's causing that to make sure it is not pressure on the nerve, and that they wouldn't have to take you into surgery immediately. So good luck, and if you haven't done already, please subscribe. Thanks a lot.